Imagine facing a significant health challenge that prevents you from working. You have successfully navigated the Social Security Disability Insurance application process, and now you have that vital support. As you look ahead to managing your health, a crucial question often comes to mind regarding your healthcare coverage. Will your medical benefits start right away, or is there a waiting period? It is a common concern, and understanding the answer can bring a lot of peace of mind. Yes, there is typically a waiting period for Medicare benefits after receiving Social Security Disability Insurance, or SSDI, approval. This waiting period is 24 months. This means that for most individuals approved for SSDI, Medicare coverage will begin 2 years after their eligibility for SSDI cash benefits starts. The Social Security Administration establishes this 24-month waiting period for most individuals as part of the legal framework governing Medicare. This period is specifically tied to your SSDI entitlement period, which itself begins after you have received SSDI benefits for 5 full calendar months. So, to clarify, the 24-month Medicare waiting period actually commences after these initial 5 months of disability benefit payments have been completed. This means that, from your official SSDI disability onset date, it will generally be 29 months until your comprehensive Medicare coverage begins, encompassing both Part A for hospital insurance and Part B for medical insurance. This structured approach helps ensure the long-term stability and funding of the Medicare program while providing essential support to those with ongoing, long-term disabilities. It is a balancing act designed to manage resources effectively. There are, however, extremely important exceptions to this rule that are crucial to understand. Individuals diagnosed with End-Stage Renal Disease, or ESRD, which requires regular dialysis or a kidney transplant, or Amyotrophic Lateral Sclerosis, also widely known as a LS or Lou Gehrig's disease, do not have to observe this 24-month waiting period. For those with ESRD, Medicare can start as early as the 4th month of dialysis treatment, provided certain conditions are met, recognizing the immediate and costly medical needs. For individuals diagnosed with a LS, Medicare coverage begins immediately upon receiving SSDI benefits, without any waiting period at all. These exceptions are in place to address specific, severe conditions that necessitate immediate and continuous medical care, highlighting the program's responsiveness to critical health crises. During this waiting period, it is absolutely essential to proactively plan for your healthcare needs and ensure you have continuous coverage. You have several options to explore. One primary avenue is Medicaid, if you qualify based on your income and resources. Medicaid provides crucial medical assistance to low-income individuals and families. Another possibility is to continue any employer-sponsored health coverage you might have had through COBRA, which stands for Consolidated Omnibus Budget Reconciliation Act. However, COBRA can often be quite expensive, as you are typically paying the full premium plus an administrative fee. Additionally, some states offer specific programs designed to help bridge this gap in coverage for individuals awaiting Medicare eligibility. You should proactively research all available alternatives as soon as you receive your SSDI approval notification to avoid any lapse in your medical coverage. This foresight can prevent significant out-of-pocket costs and ensure access to necessary care. A key insight for you is understanding your official Medicare entitlement period start date. This date is distinct from your initial disability onset date. Instead, it refers to the specific month your SSDI cash payments actually began, following the mandatory 5-month waiting period for those benefits. It is vital to track this specific date closely, perhaps by noting it in your calendar or on a document, to accurately determine when your Medicare coverage will commence, whether it is for Part A hospital insurance, Part B medical insurance, or both. Knowing this exact date empowers you to plan your healthcare journey effectively. Navigating the transition from receiving disability benefits to accessing Medicare requires careful attention to these specific timelines and a clear understanding of the rules. By grasping the standard 24-month waiting period and its crucial exceptions, along with proactively planning for your interim health coverage, you can ensure a smoother and far less stressful path to the comprehensive health care you deserve. Remember, being informed is your best tool for managing your health and financial well-being during this important transition.